Hello and welcome back. This is Dr. Gerard Cuomo. I'm here with a double implant rescue case, same patient. Teeth numbers are 9 and 11. And we went through a process of uncovering the implants with the diode laser. We also used some pre-soaking materials that we put together. And now we're moving on to actually getting the implant fragments out. And these are just custom-made instruments that I've come up with that actually will remove a fragment. And they're all different sizes and shapes, and some of them you can actually buy from your implant companies. But bottom line is it's a process where you don't have the right size, you have to develop your own instrumentation. So that's where we are right now. We're ready to get these little guys out of there. All right, so my dental assistant, she's going to turn her high-speed suction on. She's just going to kind of hang out. And we have a container for these. We always like to put them all in a nice container. This is a good lab, ADT, Advanced Dental Technologies, out of the Boston area. So we do a lot of work with them. Thought I'd give them also a shout out. Here we are now with going after the fragment. So this is a fragment fork. I go in there, it's custom made. I'm going to let it sit at the top. I'm retracting his lip and I'm going in at the right angle, straight in. That's the angle of the implant. I'm just going to rotate it gently. We know it's mobile. We don't have any problem getting it out. Eventually it'll come out. It's about halfway out now. Same scenario. Go back in, take a look and see where that leading fragment is. It's in the 12 o'clock position, so I'm always keeping that in mind as I'm turning, because you really can't feel a whole lot. Doesn't lock on, it just kind of rests on top of the fragment as I'm turning counterclockwise. And it's almost out. A little more. It's turning gently. And just about out now. Stay on the top and rotate. And there it is. You can see that now, right? You see how it's just laying there on its side? So this is where my dental assistant, she's just going to put her flat suction tip right on top of that, and it'll end up right in the screen. Just like that. And there it is. You see it right there. That's the piece. So she's now going to put that in this little dish and tap it in there. And we now have a prize. There's the first one out. And we'll be looking at that in a little bit. Sure is a nice day to go in there without having to core drill. Boy, core drilling is a lot of work. That's because we see a lot of cases with Cavitron, cold weld locking them in. And so now look at how nice and clean that is. We're going to clean it up some more. So we'll pre-soak that again. You got the idea, right? Soak it in there nicely. There we go. And you can see how dark. See this? See what's in there? That's a lot of bad stuff. We want to clean that up. Get that all nice, sparkling clean. All right, so we've been pre-soaking the other side. Now that other one is ready. The other fragment is ready to come out. We're going to let this soak in there, clean the internal threads now. See, look how black that is. See that? So when that becomes clear, when there's no longer any color related, it's clear, then we know we've done our job. And then we're going to follow this up with implant healing abutments. That would be the third segment of today. We're going to put the healing abutment so the patient can go home and let that heal up in a couple of days, and the doc can now go back in and maybe take a new impression or add an implant, whatever she wants to do on this case to put it all back together again, make it right. All right, so that's where we're at. Again, this is there's all these different fragment removers. This happens to be the one that I custom make. You have to make parts. You have to make parts. And you have to study the anatomy, the diameters especially, the threaded portion, the core portion, and this will be the next one coming out. You get the idea. Almost there. There. There we go. Put that in place. And you can see it's laying on its side like that. That's kind of cool. Let me just see if you can see that. All right, that's better focus there. Yeah, so that's the other screw. Let me get him a little bit higher. This is the one closer to the top of the lip, so it's not as easy to retract. But we're doing a good job. There it is. And it's just lying on the side, so now my assistant's going to go in and she's just going to put the suction tip right up flat, right on top of it. Creates a vacuum. And there it is, number 2 right there waiting for us. All right, so let's put that in our kit. That's implant fragment number 2. Tapping that off. We get it in there. Yep, there it is. So we got the 2 in there. All right. And they're twins today. I got twins in there together. All right. Thank you for watching, and I hope you learned something. When it comes to this kind of work, always the first one in is the best chance you're going to have without having to use power instruments, core drilling, etc. Look at that. Beautiful. Both rescued without any trauma whatsoever, without any sweat and tears, you know. It's not an easy job, but we make a tough job easy. And that's where we're at. So next step is to put the healing abutments. I'm going to pre-clean these out right now, and then we'll try in the healing abutments. Again, Dr. Gerry Cuomo. You know, it's important to know what you're doing with these kind of things, and we've been doing it a long time. You know, we're about 20 years in on using a microscope, and we definitely enjoy what we do. We love to see our patients avoid unnecessary surgery, and we've got the best team in town, by the way. Can't do anything without my team, my assistants, my hygienists, my receptionists. They're amazing. Keep watching and send in comments. I'd love to answer them. I answered about 2 this morning on some really cool questions, so keep the comments coming. Dr. Gerry Cuomo and his team, catch you in the next one. Take care.